Well, being an applied kinesiologist and using the tools that we have, it allows us to see everything that can go on with the body, almost like if you had a baseball game you were looking at and you wanted to get a ticket, but there were no more tickets. So you could stand on a rooftop like they do in Chicago at the Cubs games and look down in the game from outside the park and look and see everything you could see inside the game from outside. Or if you were like a little kid in the old days when they had these fences, these wooden fences around the ballparks, and the kids didn't have enough money to get in, so there'd be a little knot hole in the wall, in the fence, and you'd look through that knot hole and you could see the whole game through that little knot hole. What we do with applied kinesiology is we use manual muscle testing as a tool to open up that window on what we're trying to see. And what we're trying to see is what's going on in the human body through the nervous system. We're trying to understand what's going on in every facet of the human body through neurological impact that we see affecting things from structural faults and pain to biochemical imbalances and emotional and mental stresses. All these things are reflected in our nervous system and have an outplay of muscle imbalances that we can then measure and observe. And because the muscles are a reflection of what's going on in the nervous system from the brain all the way down to the rest of the body, and integrate all this structural and mental and emotional and chemical and nutritional and lifestyle factors, we're able to use muscle testing as this window to see what's wrong with each individual patient, what's unique about each individual patient. It allows us to identify what's different about each patient than what most people do in practices of different types, is they look at the bell-shaped curve and they try to find where the person is relative to the center of that bell-shaped curve. Well, at least a third to two-thirds of those people are on the outer parts of those curves, and we're able to identify what's unique and specific about their problems. And that's what excites me, is that every patient comes in the door gets something different from applied kinesiology, different that's unique to their particular needs and purposes. I've been in practice for a good number of years, and through the years, my biggest disappointment in healthcare has been associated with the lack of expectation for good health, both on doctors' and patients' parts. Patients have been seeing TV shows and read magazines and articles and so on through the years and movies, and they see the medical miracles and the great things that happen in emergency medicine and surgery and all these great things. And yet, when it comes down to the daily aches and pains that people have, they're willing to accept far less than those miracles that take place in modern medicine. They're willing to take a pill every day of their life to try to cut down the pain somewhere instead of trying to figure out what the source of the pain is. They're willing to go through life with pain or limited range of motion or mental fogginess or all types of low energy because they don't think there's anything different about it, because they've always known that. That's low expectations. We should expect the same thing from the daily complaints that people have as the miracles that we see in modern medicine. We have miracles we can perform for the day-to-day aches and pains and things that bother people. We have these things we perform, and what doctors do is they are happy if they get a good response. If a new wonder drug comes out, the response is only about 30 or 40% of the patients get a help from that particular drug. And it's great for those 30, 40%, and it's considered a great success. But what about the other 60 or 70%? These are the things that I look at, is the other 60 and 70%, all the people who are getting less than optimal function. Almost everyone I know is able to have improvement in their quality of life, in their function, decreased pain, increased mental clarity, increased energy, and decreased complaints and increased vitality if you have someone who can find out what's unique about your situation and what's unique about your needs and then supply those needs to you. Well, an AK doctor is really a portal of entry into the healthcare system using natural methods. Some AK doctors are medical doctors, some AK doctors are dentists, some AK doctors are veterinarians, some AK doctors are chiropractors, some AK doctors are osteopaths, some AK doctors are even optometrists. But the thing that we have in common, all AK doctors do, is they look at the whole body. And so regardless of, unless someone has a certain specialty in some area or another, like a veterinarian or a dentist, typically if you go to see an AK doctor, he has tools to look at the whole body and look at all the different parts of your body. As I said before, there's structural and pain-related things and movement-related disorders. There are chemical imbalances that are related to nutrition and endocrine imbalances and digestive imbalances and energy. And there are problems related to mental and emotional stress and mental health. All of these things are reflected in muscle testing, and each individual has combinations of structural, mental, and chemical imbalances that maybe favor one side or the other, but they all are integrated together. How do you figure out what side of the person's triangle of health, if you want to call structural, chemical, mental triangle that we talk about in AK, how do you find out which of the sides of those things is causing the person's problem and identify that unique to each person? Well, you do it using muscle testing, and manual muscle testing and the tools of applied kinesiology allow you to get that window on the nervous system to see specifically what are the imbalances that are being reflected from the brain out and from the nervous system, reflecting the chemistry and reflecting the endocrine system, reflecting the digestive system and so on, out into the periphery so that the body has a language of its own. And the language of the body is the muscle balance. And everything that goes wrong with us is reflected in muscle imbalances. And we can figure those out with muscle testing and identify what the unique needs are for a person. So because it's so wide encompassing, the effects of applied kinesiology, the first doctor a person should see when they have a health problem is an applied kinesiologist, because he's going to isolate where your problem is located, whether it's a chemical imbalance or whether it's a mental or stress imbalance or whether it's a structural or a functional imbalance of the muscles and bones and joints and so on, and then can correlate all those things together. And if you need other care, he can direct you or she can direct you to the other healthcare practitioners you might need. But the first place you should go is an applied kinesiologist because of the wide range of systems that we can evaluate. AK is an open system and allows us to look at virtually any part of what could go wrong with you and identify what it is and what you need to have to get it fixed. When I was a kid growing up, I lived next door to the founder of applied kinesiology, Dr. George Goddard. And my family was patients of his back in the 1960s when he was first developing the muscle testing. And AK started out as very simple, using manual muscle testing to find the strengths and weaknesses and fix musculoskeletal complaints based on muscle imbalances. Over the years since that time, AK has expanded to include of all types of therapies, from nutritional therapies to herbal therapies to acupuncture, acupressure therapies to craniosacral therapies, which some people know about. It has to do with the movement of the bones of the skull, and to emotional and stress-related therapies and lifestyle interventions and exercise, and anything you can imagine has been able to be integrated through the manual muscle testing into the applied kinesiology. So it's an open system such that anything new that comes along and has come along since the 1960s has been able to be integrated with all of the other knowledge of physiology and what could go wrong with a person and what to do to help them. That's what I mean by an open system. It has the ability to take any new information that comes out from science and put it into play in clinical practice for the patient's benefit.